Welcome, 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 Be Health Empowered family. Thank you for coming back for another episode of Excuse Me, Doctor. I'm your host, Dr. Melissa Clarke. Please call me Dr. Mel. We are here every Monday night, 9 o'clock Eastern, to bring you this show. And I first have to say, happy fall. The fall equinox just passed. And so, we are into a new time of year. And it's more important than ever to bring you these health topics based on science so you can be confident and empowered when it comes to making decisions for yourself, your family, and your community. We clarify speculation, we clear up misinformation, and we debunk disinformation. We're streaming on YouTube and Facebook. Thank you for joining us on those platforms. And if you're joining us on YouTube, please, please, please hit that subscribe button. And if you are joining us on Facebook, of course, please hit the like button and like the page. Welcome to our newbies, our first time here. Again, if you haven't done that on YouTube and Facebook, please hit that like and subscribe. So tonight we have a super special show for you. It is our Hot Topics producer show, backed by popular demand. We are going to be here answering all your questions about the pandemic, the boosters, DNA, messenger RNA, the Haitian border crisis, microchips, nanotechnology, staying healthy, and getting healthier. We are here for it all. And we're going to hear more about the format of the show from my producers later on. So stay tuned right here. Share with everybody you know. Tell them to come on into the Be Health Empowered family. Sit down in the living room and sup with us as we go through our show for tonight. Anybody who's interested about staying healthy during this pandemic, please share it with them, as we're now going into this week 8 of the Delta variant peaking. So you are not going to want to miss this episode of Excuse Me, Doctor. And without further ado, I am bringing in my wonderful team, my producer and co-producer, Miss Lila Mays, and Mr. Wayne Bruce.
Hey.
Come on in and sup with us. All right, Dr. Mel, I like what you said.
Hey.
You
That's that
know,
old Dwayne joint.
Well, I want everybody to feel welcome and comfortable and, getting their questions ready because, it's
Right.
I
going to be
like it.
on. We are going to be knocking those questions out tonight. So
Yeah.
I
please
like it.
start writing. Start writing in the chat
We're
so
gonna
we
take
can
over
get
the
to them.
show. So
Yeah, we're taking over. We're taking over. We
What?
have
uh,
been, yes,
we
the producers are taking over the show.
we's
We have
tired.
lots of things that we want to talk
Uh-oh.
about.
Uh-oh.
Right.
Uh-oh.
You know
Uh,
how people in the comments like to talk? We
Mm-hmm.
want to talk too.
we,
Uh,
Because we
I
regular
might need
people. I
I
mean,
might
we
need
not the
y'all's help,
doctors.
audience. Rein them in. Send them stuff to talk about so they just don't go totally off the wire. So,
See,
we
people
might go
talk
off the rails.
people
We might.
people talking about welcome back Lila already. I'm gonna press record right now.
Oh, thank you, y'all. Thank
I'm
you.
gonna
Lila
press
had to
record right now. So I just
all
press
right.
do a
record.
little something last week and meant to be on, and it didn't work out.
Hey man.
Hey, we're
Hi, I'm back.
glad you are here. We are glad you're here this week and that it all worked out.
Mm-hmm.
Thank you, thank you.
Mm-hmm.
So, should
Um,
we jump into it?
yeah, let's get into what we
Let's
do at the top of the show, Dr. Bill.
let's do it.
All right. Well,
What we
we
got?
always talk about the numbers to start things off.
Indeed.
So, we are 42.8 million cases of coronavirus.
Mm.
It's just hard to wrap your head around, but what we need to know is that we are at a rate of 120 to 130,000 new cases every day.
Wow.
Yep. And that's while football stadiums and indoor concerts are packed. You got football players
Packed.
like the Buffalo Bill guy. I don't really know his name. You probably know his name, Wayne. But he's the guy that offered to buy tickets for unvaccinated fans for away games.
Cole Beasley.
That guy. Yeah. So you got people like him at the same time as there are 130,000 new cases a day. There's a silver lining. And the good news is that the 7-day average of cases is down 17% since last week. So that's a blessing.
Come on, girl.
Um,
Now,
yeah, that is truly a blessing. Hopefully, it's because, a few more people are taking this seriously, getting vaccinated, wearing their mask more, um, and that hopefully the Delta variant is starting to flame out. We hope. Keep our fingers crossed.
I mean, I think
Mhm.
messaging is good though. Go ahead, lie.
Um, did we get up to what are we on people perishing? Did we talk about those numbers?
Not yet, because there's 684,000 deaths, and since we last talked last week, since we were all together, 14,000 people have died of COVID just since last week. And the
Sheesh.
daily death rate, unlike the cases, because remember the deaths lag behind the cases, the death rate is still going up. And hospitalizations are still going up. 10,000 hospitalizations daily. And they're going up specifically for children. And that's probably because of kids going back to school and
Right.
Hmm.
interacting and congregating together. And speaking of younger people, there's this myth that COVID is a disease of old people, right? I'm young, I'm 25, I'm 30, I'm 40, I don't really need to worry about it. And that myth is basically because when you look at the number of cases and deaths among white Americans, only 12% of white American deaths were of people under 65. But when you look at it for black and brown people, it's a whole different ball game. For black and brown
Mhm.
people, 30% of black people and 37% of Hispanic people um, are have deaths under age 65. So that's a third of the deaths in each of those groups are happening in people under 65. What does that look like? That means that more black and Hispanic families are being left without breadwinners, being left
Mhm.
without parents, being left without caregivers. And so if you as a black and a brown person are relying on youth to shield you from severe COVID and death, that's probably not a good game plan. You probably really need to think about vaccination. And we're not even talking about long COVID, right? We're not even talking about,
Right.
you know, all the people that are getting long COVID as a result of even having a mild COVID infection.
Right.
Right. Yikes.
I,
All
Yeah.
right, Dr. Mel.
well,
So
go ahead.
yes,
Va-
let's talk about Vax Facts. Let's get on into this Vax Fact situation.
Right. Well, before we talk about Vax Facts, Wayne and I were talking about this funeral van that was rolling
Yeah, that leads
around.
into it's all about
Yeah, he
facts.
was the one that hit me to this. You
yeah,
got something to tell us about that?
this is the has been the hit, unfortunately the hit of the internet. Like, this thing is viral, and it's a fake funeral van that circled the stadium of the Panthers, NFL Carolina Panthers, and it circled.
Mhm.
And when you it says don't get vaccinated, and it has a funeral company. Well, the people who put it out are vaccination people. They do vaccinations. They're a healthcare company. And when you click on the what is it, Wilmore Funeral Home, when you click on
Mhm.
on the link, it actually takes you to a vaccination page.
So
And
has it been effective?
it's their vaccinations have increased by 30% in a week.
Wow. Yeah, I would say that that's pretty effective.
Hmm. Yeah.
And I'm glad that they were doing it in North Carolina, because with our Vax Facts, we know that the South and the Midwest have the lowest rates of vaccination. And it's so much so that they're doing care rationing in hospitals in those states. Whereas in more vaccinated states like New York, California, and Maryland, hey, Maryland, um, they're not being overwhelmed because their vaccination rates are much higher. So we're up to 182.5 million people vaccinated. That's 64.3% of all eligible people over age 12 who are now fully vaccinated in the United States. So
Wow.
that's a great thing.
Wow.
Yeah.
And there
All
you
right.
But
go.
we need
There's
more.
We need more. So look, we're getting ready to take over the show, man. Let's. I mean, we didn't got through Vax Fast. We got through the numbers. I don't even want to bring it. Let's go to my favorite section of the show.
Let's do it.
Let's go to the
weekly debunk. Stopping misinformation in its tracks.
Tanisha Twitter finger said, one of my favorite singers, this is her favorite singer, one of my favorite singers is out here talking about the vaccine is personal, which is why it should be a personal choice. You're getting the vaccine only helps you. Me getting the vaccine only helps me. People have died still, fully vaccinated. Your choice. Don't let people take away your choice.
You said it right. Your choice. Your choice. I don't know about that. Excuse me, Dr. Mel. Is that true?
Well, taking a vaccination is a choice, and it is a choice that you as a person has to make. But it's not a strictly personal choice because it is a community spread issue. It is a public health issue, and whole communities are being affected by one person's choice to take or not take a vaccine. So once you're exposed to the coronavirus, if you're vaccinated, the antibodies that you already have built up in your system because of vaccination will cut down on the amount of virus in your system. So you're way less likely to get severely sick, and you're contagious for far less time than if you weren't vaccinated. And because a virus needs a host to live in, it needs a person to live in, by doing that, you're effectively helping to stop the spread of the virus and essentially kill it. So if everybody was vaccinated, there would be zero to very little spread of coronavirus. And, again, it's not a personal decision. We've heard about Kyrie Irving. I know y'all have, aside from this R&B singer, he's also out here talking about it's a personal choice. And I heard one sports analyst say, it's not a personal choice for Kyrie Irving because there's so many other players who depend on him being there at games. And if he's banned from games because he's not vaccinated, that might affect their legacy, their ability to go to the playoffs, their ability to win championship rings. It might affect their salaries down the line and their ability to get bonuses, not to just mention the fact that he might be affecting and infecting not just people on his team and coaches, but also people in the refs, the stands, etc. So again, it's important to protect your tribe, those people that depend on you, those people that are near to you, to allow us all as a society to function together more safely.
All right. And there we have it. So the takeover begins. We off to recap, man. Off to recap. So look,
right.
let me
you
say
mean
this.
The debunk. We off the debunk.
And we off the recap. Look, I done canceled all that. So let me say this, though. Kyrie Irving aside, Kyrie Irving is the biggest name, right? But for the people in the DMV, Bradley Beal is not vaccinated and said he will not get vaccinated, and it's a personal choice.
And who is he?
He's the star of the Washington Wizards.
Okay, thank you very much.
He's the star of the Washington Wizards. Andrew Wiggins, small forward for the Golden State Warriors, won't be able to play home games because he's not vaccinated, and he did not get a medical exemption. They're not playing out here, y'all. I mean,
no, they're not.
We're trying to stop a public health crisis.
Well, actually, I think he asked for it based on a religious exemption, right?
And they didn't. They denied it because
they denied it
because the religious exemption wasn't believable. I mean, he created that.
I see.
His agent.
Okay. And like I think one of the other basketball players is out here saying, religion and science go together. It's not an either or. It's a yes and.
Come on now, Lala May.
Ellen Claire Lamb says, what would be a valid medical exemption? So I'm going to let Dr. Mel answer this, but I'm going to throw back to this question that's come up many times. For starters, if you are allergic to any of the ingredients in the vaccine, Dr.
That's
Mel.
Right. That is one definitely legitimate reason. Another would be if your doctor is doing some kind of treatment that is temporary and might affect your ability to have a response to the vaccine. It's sort of like, what's the purpose of vaccinating you right now because your immune system is down for whatever reason. So this would apply, of course, to oncology patients who might be undergoing chemotherapy, or transplant patients who are receiving high doses of immunosuppressive drugs. But of course, that would be a decision that you and your doctor would make together, and they would write you a note, a medical note that you would be able to show to your employer, explaining why, from a medical perspective, it would not be a good idea to take the vaccine right now. But that could change down the line once your immune system rebounds from whatever the treatment is and you regain your health, and it makes more sense to get the vaccine at that time. So that really, those are kind of the options. Perhaps if you've had a complication of a vaccine in the past and you're concerned that you might get it again, or again, a decision to be made with your doctor, and your doctor could write you a medical note. So those would be the only ones that came to mind.
That's good. So we have a comment from YouTube. Rel NM said, I just left South Carolina and tried to find a rapid COVID test for my old folks and myself. It's difficult to find a test. It was difficult to find a test. I left and the folks found out they have COVID. This blew her away.
I'm so sorry to hear that, Rel. I would say if you haven't been tested, you definitely should be tested. If you don't have symptoms, it's more important that you get a PCR test as opposed to a rapid test, because rapid tests are not very reliable when it comes to diagnosing people if they don't have symptoms already. You know, it might be difficult. I grant you that, because of the Delta variant being so much more transmissible, more people are concerned about getting tested. It's also allergy season. And so people are having symptoms like runny noses and coughs and sneezes. And so that's also driving people to get tested. But I would just really check with the local health department where you are, check all the urgent cares. A lot of times, a lot of the chain drugstores like CVS and Walgreens have tests. And of course, check if you have a doctor, if you have a physician. So try to exhaust all those resources in terms of trying to get tested. But our hearts go out to your parents and hope that they have a speedy recovery.
Indeed.
Right. So Mel, Dr. Mel,
Yes.
I'm sorry. I said, did I say
You
Mel?
got real comfortable.
I got too comfortable.
Yeah, I mean, you taking over, but
Oh Lord. So
keep it
Dr. Mel,
PC. Keep
I'm
it PC.
sorry. So let's talk about Texas.
Yeah, let's talk about that.
So-
My home state.
That's your home state, is Delilah. So
Right.
I have family that's about to leave because they are tired of just
Of the Texas nonsense.
of the Texas nonsense. And she's actually pregnant. So she's like, I don't want to be around people. Nobody wears a mask here. She's not required to wear a mask in her job. Nobody's there. She wants to
Which
leave
is
the
at a
state.
university.
Which is at a university, in your state. Your state.
Your home state.
My home
Yeah.
state.
But it's a bright spot in Texas.
I was gonna say,
However, it's a rose in Texas, isn't it, Lila? Did I get that right? Right?
Yeah.
Is El Paso the Texas oasis? What's going on?
Come on,
there,
El Paso.
Yeah. So now remember, El Paso is where that terrible Walmart shooting happened in 2019.
Oh, wow.
But the silver lining is, as a result, they have bonded as a community, and they have a strong sense of community and looking out for each other. And so they have one of the highest vaccination rates in the state of Texas. And with the surge of Delta variant going through the state and, causing mayhem, El Paso has been the one little, oasis that has been unscathed in this whole thing. So it's the high vaccination rates, it's the widespread compliance with masking and social distancing, and that, enhanced sense of community they had after the 2019 tragedy. Those are all the reasons that it seems that El Paso's Delta numbers are low. And that's really a wonderful thing. So just to give you some numbers to tack on with that, while 30% of the hospital capacity in the rest of Texas is taken up by people with COVID, only 7% are hospitalized in El Paso. So that's pretty amazing. Shout out to El Paso.
Shout out to El Paso.
Come on,
and
El Paso.
it's the power of vaccination and following these
Come on, El Paso.
guidelines. Yeah.
We see you, El Paso.
And realizing that it's not a personal choice. It's a community choice.
It's community. Exactly.
Yeah. Exactly. I want to say this because they can't see. I see everything in the comments. It's a community choice. No matter if you think Dr. Fauci helped produce a human strain of COVID virus and Barack Obama paid for it.
Oh my God.
We don't care. It's still
You know what? I don't know if that's true, but it doesn't really matter at this point because it's here and we got to deal with it right now.
Yeah.
I don't know where it came from. I don't even speculate as to where it came from. But it's important to know that it's here and that we have to go by the science and the evidence to make sure that we can get beyond this pandemic and come out with as many people alive on the other side as possible.
Okay. I mean, we're basically 2 years into this thing. This is wild. This is almost 2 years, depending on when some people got sick, which was end of 2019. Really, we're looking at 2 years of a pandemic because we don't want to play community. I mean, really, that's what it boils down to. We got to do better.
Yeah, we got to do better. I mean, so I just heard this earlier. So many people have been vaccinated for school, for different reasons and everything. And you're worried about this vaccination.
Right.
For real?
That's and then I like this car crash analogy that I heard. Social distancing, masks, and hand washing are like traffic signals. So by obeying them, you help to prevent car crashes, which are like COVID exposures. If everybody does it right, there are no crashes. But if I mess up or you mess up in obeying the traffic signals, we're more likely to have an accident, right? Because one of us ran the stop sign. Right. Vaccines are like seatbelts. They don't prevent a crash, i.e. an exposure to COVID, but they prevent the consequence of the crash being severe or deadly, you being ejected from the car. And then medications are like airbags. They deploy after the crash has already happened. So you don't want to wait for which would be like the monoclonal antibodies or any of the other treatments you get to the hospital. Airbags don't prevent accidents. So, and you really don't want to get into a severe enough accident where you have to deploy an airbag. Right. So that's why you want to wear your seatbelt and obey the traffic signals so it doesn't have to get to all of that.
There you go.
Indeed. And I'm going to say this, and these are the views of this co-producer and not necessarily those of the host or the other producer of this show. But if you have a platform like our favorite R&B singer, who Tanisha Twitter Fingers was quoting earlier, you really get to be responsible and use your platform for good. If you don't really have the facts and you're basing your information off of conspiracy theories and these Russian bots and the far right information, if your points of view align with white supremacists, A, you need to check yourself. B, shut up. And if you don't want to get vaccinated, stay your tail at home. Okay? Those are views of Lila. All right.
Okay. Welcome back, Lila.
I second that emotion. I'm with you, Lila.
It's ridiculous.
It's come on, man. Come on. Like, sit down.
Well,
Sat down.
one of us has to be good cop, and I have had many a conversation with many of people who are vaccine hesitant, vaccine resistant, and they sometimes last 30 minutes, 45 minutes, an hour, just going through each of the sources of the conspiracy theories and trying to help them understand that they're not valid, and understanding what the real science is and the real evidence and the real truth behind each of their concerns, to try to help them, give them a new script to read from, a new hymnal to sing from, rather than the one that they've been singing from now. And it's a process. It may take several conversations, because social media has just so thoroughly infiltrated people's consciousness that it's ridiculous.
It
Wow.
is.
Yeah.
So
what else y'all got?
This one, this care rationing situation. Okay, I'm stirred up. Okay, I'm charged up, as Drake would say. I'm charged up. And care rationing. So we've already spoken in previous shows many times about the disparities in healthcare with Black people, Black women. But this care rationing thing, Dr. Mel, you got to break it down for the people. This is something.
Well, we mentioned at the top of the show about how care rationing is happening now as we
Yes.
speak in many states and many cities and hospitals across the country. And a lot of the times, in order to figure out who should get care and who shouldn't get care because they're too far gone, so to speak, doctors try to use an objective criteria, a scoring system called SOFA. And it's an acronym, which I won't go into, but it basically helps determine the person's probability of survival. The higher the score, the lower the chance of survival. And so they might decide not to use resources on that person because it would be a lost cause, and use resources on persons with a lower SOFA score. But they did a study at Yale, and it was published this past week, that found that Black patients with COVID who were admitted to their hospitals typically have a higher SOFA score than most whites admitted. And I'm speculating, this is purely speculation, because it could be that Black people wait longer to show up for care. But even though Black patients have higher SOFA scores, their death rates are about the same as whites with the same SOFA score, with better SOFA scores. And so the authors of that study were warning that by using this SOFA score system to triage people and decide who to treat, that you might actually be diverting resources and steering resources away from Black people who actually could benefit despite a higher SOFA score. And all this, that's a lot of maybe language around SOFA scores. The bottom line, which I've been saying in one of the very first broadcasts of this show back in April or May of 2020, one of my fears when we were talking about flattening the curve was that if hospitals got overwhelmed because of implicit bias, just bias that healthcare providers have when they look at somebody who doesn't look like them versus somebody who does look like them, that they might decide to favor the person who looks like them. I've been concerned about this the entire time. It's one of the things that propelled me to do this show, to really sound the warning sign to communities of color. Look, protect yourself. You don't want to be in a situation where you're having to seek care in a situation where there are few resources to go around, because you might be at the short end of the stick. And here we are. Get vaccinated, y'all, please. This is really important for everybody, not just Black and brown people, everybody to get Black and vaccinated. But for Black and brown people especially, it's important to protect yourselves, to not get sick. I'm not saying that my healthcare colleagues are trying to do you ill. A lot of times, like I said, it's just biases that people have because they grow up in a racist society. and it's deeply embedded in their subconscious. But why even be in a situation where you have to depend on that? If you have to go to the hospital, of course, go to the hospital. But I'm saying, if you can avoid it, get yourself vaccinated, because people who are vaccinated are not overwhelmingly ending up in hospitals, are not
Right.
ending up in these situations where care has to be rationed.
Wow.
Mm-hmm.
Here's a question from YouTube, LifeSpark. LifeSpark asks, I am fully vaccinated as of last Tuesday. How long do I wait to get a mammogram, CT scan, and a bone density test?
Great question, LifeSpark. We talked about this a few months ago, but it hasn't come up recently. So thanks for bringing it up again. What you might be referring to is the fact that when you get vaccinated, that it can cause lymph nodes in your armpit, and even around your neck area to swell. That's normal. That's appropriate. That's your body's immune system sending antibodies and producing antibodies in those areas closest to the side of your body where you got vaccinated. That's perfectly fine. But what radiologists have said is, hey, if you can afford to wait for 4 to 6 weeks after vaccination to get CAT scans and mammograms, because we don't want to have a false reading and be concerned about these lymph nodes, and we don't have the context that you just got vaccinated to explain why they're there. So that's generally the recommendation. Wait 4 to 6 weeks before you schedule those studies. If it's an emergency, of course, talk with your doctor, go ahead and schedule them. If you're in the middle of treatment for something and your doctor thinks it's important to go ahead and do it, your doctor can certainly say, hey, look, to the radiologist, this person just got vaccinated. So do it, make those decisions in conjunction with your doctor.
Okay. Hey, Dr. Mel. See, I put that doctor in front, didn't I?
You sure did,
I
yeah.
put that doctor. Not too comfortable. Not too comfortable.
All right.
So we have two questions about the same thing, and that's about the booster. So from Sherry Hazelton, I've had COVID-19 last year with little to no symptoms. I'm fully vaccinated. I feel more fatigued since getting vaccinated. I will not consider the booster. And then we have another question that was earlier in the show that I wanted to hold, and I got to scroll back up.
Well, can I answer Sherry's question
yeah.
first? Or they go together?
They kind of go together.
Okay.
The booster shots, what do you feel about this? And I'm in the age bracket of 65 plus.
Okay. Well, first let me talk with Sherry. So Sherry, you said that you feel more fatigued since getting the vaccine. I would say fatigue is a very general thing, and it can be a sign of a lot of different things in your life. Everything from depression to a cold to any number of other issues. I would say if you're feeling fatigued, you really should get a thorough exam and checked out by your doctor to make sure that it's not just coincident that you happen to get the vaccine around the same time that something new has cropped up in your life that's making you fatigued. So before you make a decision about it being due to the vaccine, talk with your doctor to see if there might be any other reason that's causing fatigue, because that is not necessarily one of the documented side effects of the vaccine. Yes, it does happen sort of in the first 72 hours, but beyond 72 hours, if you're still feeling fatigued, that's definitely something to get checked out. And then as far as the boosters, we know the FDA and the CDC have both agreed that if you got the Pfizer vaccine, you should be lining up to get a third shot after 6 months have passed. If you are over 65, if you have a low immune system for whatever reason, if you have underlying chronic disease, and if you are in a high risk occupation. So that would be teachers, healthcare workers, morticians, those kinds of high risk exposures where you would be around people that may be carrying the coronavirus. So I would say, if you're asking me what I think about getting it, I would say, yeah, I get it. I'm going to be getting mine. As a healthcare worker, as somebody with an underlying health condition, I would definitely will be planning on getting mine if and when that comes down the line for Moderna, because I was vaccinated with Moderna. So of note, Moderna and Johnson & Johnson, they have not, the FDA and CDC has not ruled on people who got those as their original doses. Of note, Moderna is still doing great, 92% efficacy after 6 months at keeping people out of the hospital and without severe COVID and death.
And just in a moment of real transparency, I'm giggling because we're all real people, right? And I literally just said to Dr. Mel a couple of weeks ago, maybe a week and a half ago, I was like, yeah, I don't want to get the booster. Dr. Mel was like, why, Lila? And I was like, because my arm hurts and I'm attributing it to the vaccine. Dr. Mel was like, you got the vaccine in March, right? So have you carried yourself to the doctor to figure out why your arm hurts?
Right.
I'm
Exactly.
like, no, I'm just blaming it on the vaccine. Well, it's actually, Dr. Mel, seeming to be a rotator cuff issue, and so I'm gonna have to have an MRI.
Wow.
But yeah, we real people too. We have the same thoughts. I'm just saying that to say to you all, Sherry and whoever else had the questions, we have the exact same thoughts, and we all have to be responsible in our
Right.
health care.
Wow.
Yeah.
So
Thank you
Just
for
bring that
sharing
up.
that, Lila. In other words, don't just because something happens in your body and you also were vaccinated at some point in the
Hmm.
last 9 months, don't assume that it's due to the vaccine. Get it checked out.
Right, right.
So, two people, and I'm going to share their stories on the boosters. Sherry Hazelton said again, I've seen my doctor and had blood work. She said fatigue is a side effect from having had COVID.
Right.
Mm-hmm.
So that
Mm-hmm.
makes much more sense. Long COVID is a thing, and fatigue is one of the number one um, side effects. And actually, a lot of people have reported that once they got vaccinated, that a lot of their symptoms of long COVID disappeared. So I would say I would not assume that getting a booster would be a bad thing if if your fatigue is due to your original COVID infection.
Okay. We have from Pamela Candidate Chapman. We have, what's the deadline to get the flu shot this season? And should we get the booster and flu shot simultaneously? As I do my
Great
hand like
question.
this.
Yeah. Great question, Pamela Kennedy Chapman. Hello. Um, so there is no deadline per se. The recommended time to get the flu shot is any time from mid-October on through February. But really, the ideal time is to get it in the early fall, like I said, mid-October to mid-November, because that way the immunity that you get from it will last through the entirety of flu season, which tends to end around May. But again, if you get it as late as February, you'll still have immunity to take you through May. It's just that you will have exposure in October, November, December, and January that is unnecessary since you can get it earlier. And what was the other part of the getting vaccinated for
The
COVID?
booster.
Yeah,
Should
the
we
booster.
get the booster simultaneously?
Yeah, I think it's still recommended that you space them out at least a couple weeks between the flu shot and the COVID vaccine.
Okay.
Okay.
So, takeover continues.
All right. What you got?
What you got, Lie?
Well, uh, we had a bunch of conversation around pregnant women and around the vaccine, and so now there's discussion about pregnancy exemption for COVID vaccination. So let's hear what Dr. Mel has on that.
So, President Biden and a lot of states, even before that, were requiring COVID-19 vaccines. And so this whole issue of exemptions, who's exempt from taking it, has come up. And hospitals are kind of at the forefront of this, since healthcare workers are being mandated to take the vaccine. So New York State is basically saying, we're not giving pregnant women exemptions. The EEOC says that pregnant workers must be treated the same as others who are similar in their ability or inability to work. So basically, pregnant women need to be treated like everybody else. And we know that the CDC recommendations urge pregnant patients and those hoping to get pregnant to get the COVID-19 vaccine. And that's because when you're pregnant, the Delta variant especially is putting more pregnant women in the hospital than ever before. They're going into ICUs because of COVID pneumonia, especially once you get past 6 months and your uterus pushes up against your diaphragm. It's more difficult to get air into your lungs. And so it's leading to more pregnancy complications, and women are having to be delivered prematurely just so that they can survive if, heaven forbid, they're getting COVID and ending up in this situation. So it's really important to keep pregnant women out of the hospital, and the best way to do that appears to be through vaccination. Now, at the same time, another EEOC statute says that employees who are not vaccinated because of pregnancy may be entitled to adjustments to keep working. And so there are other states outside of New York that are giving women pregnancy exemptions. So it's kind of still up in the air. If it was up to me, I wouldn't have it as an exemption, because the science is very clear that, over 175,000 women have been vaccinated against COVID who are pregnant, and there are absolutely no increase in bad outcomes of pregnancy. And on the flip side, we know that COVID can really be devastating for a pregnant woman.
Right.
Got it. So there you go.
Yep.
We have a question from Tracy Walls. How many
Hi,
variants
Tracy.
are there out there now? I need this. I need for this to go away.
Alpha,
Shoot,
Omega.
I missed my 40-year class reunion.
Yeah.
Shout out to the class of 1981 in the house. Still looking good, all of them.
So I don't know the exact number of variants. And remember, they're variants of concern versus variants of interest versus variants that are just running around, not necessarily doing anything. So variants of concern are like the Delta variant or the Alpha variant, which clearly have the capability to take over and be the dominant variant in the population because they're more transmissible. So a variant of concern is either more transmissible or causes more severe disease. Then you have the variants of interest. They're just out there. They're not necessarily causing more illness, and they're not necessarily more severe, but they're just noted that they may one day become a threat. And so there are many of those. But keep in mind, there have probably literally been hundreds of thousands of variants that have formed since the pandemic started. And that's because every time somebody gets a coronavirus infection, they can be the source of a variant. So every time viruses get copied in our bodies and more little baby viruses get made, in that production process, changes can happen. Those are called variations, and hence the term variants. So that's why getting vaccinated helps cut down on the number of variants that pop up in a population. So great question. I don't have the exact numbers for you, but that's basically how variants are classified, and that's how they work.
And I think you need to shout out the class of 81.
Oh, shout out to class of 81, even though I was class of 82. But class of 81, hey, y'all's reunion was this year. And sorry, it was probably virtual.
Took it on the chin. Janice Forte, I have the COVID vaccine already. What's the purpose of the booster shot? And then we're going to move on from that. the booster
Yeah.
activity.
Um, Yeah, so great question. We kind of talked about boosters just a little bit ago, but the purpose of the booster shot is what they're observing with people who got the Pfizer vaccine is that immunity after about 6 months is waning, is going down. And so immunity oftentimes with vaccines, it's like a muscle. You have to stimulate it or re-stimulate it and use it so that it doesn't get flabby, right? And so the purpose of a booster is to re-expose your body to the spike protein in a harmless way, meaning not by getting COVID, but in a harmless way through vaccination, so that your body can go, oh, this is still a threat. Let me beef up my security again. Let me make more antibodies. So it's a booster. It's to kind of kickstart your system all over again.
All right.
All right.
All right.
All
Now,
right, what y'all got? What's next?
how much weed
Producers.
is too much weed, Dr. Mel? Is there such a thing for our partakers? They have questions.
Uh, Yes, well, for the partakers of weed out there, and I am not an anti-weed person. Um, it does definitely have therapeutic effects for lots of people, but you know, too much of a good thing is not good. And so, what we're seeing more and more in those areas where there's a country where marijuana is legalized, that more and more people are showing up in emergency departments complaining of severe intestinal distress, retching, vomiting, and it's called a cannabis hyperemesis syndrome. Hyperemesis just means a whole lot of vomiting. And they're seeing that symptoms go away when cannabis use is stopped, but it returns when it's restarted. And so there was an article that was just published that found over 800,000 cases of this syndrome reported in Colorado between 2013 and 2018, which was approximately a 30% increase around that since marijuana was legalized in the state.
Hmm.
And they seem to happen in young people, especially those 25 years of age and younger. Some people say hot baths help, but in my experience as an emergency physician, I've taken care of people with this issue. And so we see the people for whom the hot baths didn't work, and they end up having to
It's
go.
not funny.
Yeah,
I'm
it's
sorry. I'm
not
sorry.
foolproof.
So, I mean, I'm down with hot baths and everything.
Mhm.
It's
Well, we
just
know people.
we
Yeah,
know
we know
people.
people
We know
who've
You
had
people.
do?
edibles a little
Okay.
bit too much,
Oh
and they
yeah.
got sick, and they was calling on the Lord in the bathroom on their knees
Yeah.
and stuff.
And making
Yeah.
deals with
Like
God.
And
they was
edibles
making
are
deals with God.
edibles are a huge problem because when you smoke, you get the immediate effect. So when you've smoked too much because you get the immediate effect. But with the edibles, it takes about half an hour to an hour for it to kick into your system. So if you're steady eating the edibles thinking you're going to get an immediate high or immediate rush, you will overdo it, and then an hour later is when you realize the effects of it. And I know several people who've gone to the emergency department after eating edibles, not necessarily with the hyperemesis syndrome, but with racing heart, uh, um, feeling paranoid, feeling short of breath, um, racing thoughts, just very, very scared because they think they're about to die. Um,
Hmm.
yeah,
Hmm.
so
I
that's
think
the
it's
issue.
happened to people who maybe experimented once or twice in their lifetime. If you experimented more than 5 times, you might have had that.
Yes, I took care of many a young people with that. Yes.
And Tanisha Monique Miles says the recumbents are causing problems too.
Okay. Recumbents?
Recumbents. I don't know.
What does
Uh,
that mean?
I don't
I
know.
have no idea.
What does
All right.
that mean,
You
T?
Tanisha Monique Miles, tell us what that means. All
Yeah, you
right.
might have to break that down for
Break it
us.
down for us. Because
Because
I'm not in the weed game.
T is in the medical industry in Los Angeles. You
Is
know,
she?
it's legal all up and through in California. Yeah, she is.
All right. Come
Okay.
on, T.
Well,
So
I don't know if she means this, but fentanyl is being laced into just about
Yes.
everything that you can buy on the street,
Yeah.
and
That's so
weed is
sad.
no exception. So
yeah.
we know that for the Michael K. Williams, who died about a month ago, God rest his soul, that he consumed products that had fentanyl in it, and that
Fentanyl.
was what was responsible for his death. And for those people who don't know what fentanyl is, it's a narcotic, and it's 50 times more powerful than morphine. And so for people who might be used to, their normal heroin dose, if for some reason it gets laced with fentanyl and you take what you think is your normal amount, it can kill you because it's way more potent than what you're used to. And things, weed, crack, meth, heroin are all being laced with fentanyl because it's cheap. It's cheaper than the actual product. And so people are lacing it, distributors are lacing it with these products with fentanyl.
So
Mhm.
so the word it's in is
Yes.
pronounced recombinants,
Okay.
and
Recombinant.
it's the fancy variants of weed.
Ah, okay.
Come
Oh.
on,
We have
T.
been we
T
have
for
been
the
schooled
win.
here on Excuse Me, Doctor.
We not scared.
Excuse me, doctor, let
We're
me
not
tell you what
scared to learn.
recombinants are. Thank you.
Recombinants. Yeah, recombinants.
Yeah, thank you very
Okay.
much.
We're
We
not
appreciate
scared of a lesson. I'm not scared of a lesson. I'm not a doctor. So we always ask Dr. Mel those questions.
you.
So,
All
Dr.
right.
Mel,
Yes.
somebody from Texas I know who's on the stream had a question for us for me the other night.
Okay.
And she wants to know, how did the immigrants get to Texas?
I need to understand
She
how they
needs a
got from Haiti to where. I just don't want to understand it.
right.
And beyond how did they get there, there's several other components, right?
Right.
Health
Yeah.
crisis, immunization,
Right.
Right.
mental wellness, the damn people on the horses with the ropes, all of that. It's like it's a whole
And
thing.
the
So Wayne,
whips.
you could break
Yeah.
it down. The whips,
Yeah.
all of it.
Yeah. And let me get rid of the too much weed thing. So let me get rid of too much weed. Um, just let's pull up that. How boy, I'm pulling up fancy little things. How did the
Come
immigrants
on
get to
here,
Texas?
Texas.
And
Okay.
So,
why is it a public health crisis?
well, how they got there may be beyond the scope of Excuse Me,
It
Doctor.
is. It might be.
In my reading, though, my understanding is that after the 2010 earthquake there that devastated the country, many Haitians fled to South America, to Chile, especially because there were jobs available. But then recently, the Chilean government decided, okay, we don't want y'all here. And they made it much harder to get citizenship, and they actually started to deport people. And they deported them to the Central American countries like Panama, and through communications, WhatsApp, just unofficial communications channels within the Haitian community, a lot of people were led to believe that the U.S. border was open. So hundreds of thousands of people made their way after being deported from Chile, made their way up through Central America to Mexico. Some settled along the way, but some decided, yeah, I'm going to try to get into the United States. And so that's led to the crisis that's at the border. And you're absolutely right. In the inhumane conditions that I understand are at the border in this time of COVID, and even without COVID, just the kinds of diseases that spread in refugee camps, because that's what they are. They're
Right.
refugees. They're seeking asylum in the United States. You have issues related to poor plumbing, poor respiratory health. So you get things like TB, you can get things like hepatitis. And then, of course, we're not even talking about the mental health effects of that, plus being chased down by Border Patrol on a horse with whips, whipping you. So it is truly
In
a public
2021, that
health.
is.
Yeah, it's
I mean,
shameful.
ever, but
It's
Yeah.
shameful.
It,
And, I don't see, you know, I can't see from where I sit what the issue is with granting asylum to these people who have been deported, who are basically escaping a country that has been devastated by natural disasters.
So
So
my
yeah.
question is the public health question. It really is part of the mental health question. So for me, seeing those images really triggered some mental health sadness, overwhelming sadness, overwhelming feel of just like this saga won't end here in America, and really it brought up a lot of emotions in me, and I can only imagine for the refugee what kind of emotional problem, mental health issues they may have while holding their baby girl on their neck trying to cross a river.
Yeah, exactly.
While getting whipped.
Right. I mean, it's terrible, and it also brings up one of the other issues that I always worry about with the mental health of Black and brown people in this country, watching the images of police brutality, and we see a steady stream of them on Facebook. They get inbox to us, they get DM to us, we see them on the nightly news. What is that doing to our mental health to watch that? Of course, we don't want to deny that it's going on, but do I have to see the footage over and over and over again when I know that it's real and that it exists? And especially I worry about our children that are watching this and having it form an image in their head and causing further trauma. And I think seeing those the immigrants, the Haitian immigrants, being treated like that is yet another example. I mean, we just, as Black people, we shrug our shoulders and we go, yeah, there it goes again. There, it's happening again. But what's it doing to our consciousness, our subconscious, our levels of stress, and ultimately our physical health?
Yeah. Right. Well said. I think that's that. So Wayne said overwhelming sadness. It really enraged me, right? Because it definitely takes you to these other experiences that we've witnessed, that we've seen over and over. Police brutality certainly took me back to images of slavery and all of that. Like all of that stuff was stirred up in me and seeing these images. Dr. Mel, any idea how, well, I don't know that you can answer this, just the tackling of this many people in one place and it being a health crisis in the middle of a pandemic?
Well, we certainly have international experience with going to other countries and helping out in refugee camps. There are any number of organizations, the Red Cross, Doctors Without Borders, WHO, that send workers into these situations to ensure that public health measures are followed, that people have the resources. I just don't know if that's what's happening in this situation.
Right.
And it should.
Well, here we go. We've come to the end of the show.
Wow. That was quick, y'all. Well, thank y'all for taking over. I think it was a good show. I certainly enjoyed it. And the audience, y'all had some great questions. Thanks for keeping them in check and making sure that you got your questions in, making sure they didn't go too far off the rails, but they did a great job. And
so we're gonna
and the audience, as always, does a great job.
We're handing it back over to you, Dr. Mel.
All right. Well, thanks for joining us, y'all. And that reminder on the side there, if you haven't had a chance yet to hit subscribe on YouTube, like on Facebook, please go ahead and do it. We hope to see you back here next Monday, 9 p.m. Eastern. We're going to be here to do it all over again. If you have a chance and you're in one of the markets where the Russ Parr Morning Show is, you can tune in tomorrow morning to hear me at 7:45 Eastern time in the morning. I know that's early, but for those of y'all who are early birds, check it out. And if I don't see you before next Monday, please remember to be wise, to be well, and to be health empowered. Thanks, Be Health Empowered family, for joining us. Thanks again to our producers, and y'all be safe out there.